David is one of is very valuable in the life sciences world because he has worked in different industries before, not like many of us who've been with life sciences and healthcare all the time. He has been with in other sectors, so possibly has a very rich view of the developments in this area, has direct experience. So David, floor is yours.
Thank you, Luis, for the introduction. Let me share the screen. Can you see the screen? Okay, thank you. So, thanks again, Luis, for the introduction. Congrats, Sofiat. Very also interesting presentation. You touch many critical points, and then we will also touch them on our perspective on the IT technology providers. Hello to all attendees. Thank you for coming, and just thank you also to IE for the invitation and for the organization of this event with such interesting and important topics. So let's start. A lot can be said about this concept. It's true. We will try to focus on the implementation, a critical part, the challenges or the problems that every implementation face, and always focusing on the technology part and the solutions that we have. Okay, that is the idea for our presentation. Okay, okay. So we structure this way. We will go through briefly on the technology, how it's impacting on our lives and the data. Everyone is now talking about data, big data, and also this is impacting our lives and then healthcare especially. And then let's go to the core part of the presentation. That are challenges on the implementation of a value-based healthcare, and the final conclusions. Okay, this is the idea. So, in terms of technology and smart data, so we use in almost every sector and in our own lives technology. So this technologies is changing now the way things are being done at an incredible speed. Okay. So, but this allows improvement in quality of life. We see a lot of gadgets. We are experiment these changes. This is happening. Okay, and hyper personalization, productivity, faster innovation, all of this. So data is critical. Okay, to provide better products, better services. So we have like a scheme there, like it's like a virtuous cycle. No? Data leads to results, leads to better knowledge, and this will make us to have better decisions. Okay, and this will generate new data, and this is cycle. Okay, so passing to the healthcare, how this is being used in healthcare. So we see in healthcare a number of or enormous amount of quantity of information being generated every day in healthcare organizations, but sometimes not exploited, or organizations don't take advantage of it. Why? Sometimes lack of standardization. The data, it's not standardized in order to be analyzed, in order to be compared, in order to be measured. Okay, then we need some kind of a culture change. We need some change here because we are talking about maybe transparency, a culture of measuring to improve. Also, it's here. It means a change in every player. Okay? And then an important concept that is the patient. It's not in the center yet. It's coming. We see initiatives where the patient is already in the center, We know technology puts the user in the center, and so healthcare has to do the same. So the patient here has a lot to be done, to talk about. It's a patient that is more informed. It's a patient that wants to be empowered. All these concepts are now being brought out on healthcare and value-based healthcare. So specifically, this concept, a very critical part is the implementation. So what value-based brings, it's like putting some order, some standardization, some methodology in order to improve, in order to measure these outcomes. Okay, we see yet a gap between the theoretical part and the implementation, because we see a lot of PowerPoints, and we wanted to have more and more real projects, but we are coming to that stage. And then we see a lot of challenges that we will describe that must be overcome. These challenges, problems, barriers sometimes mean that the project don't be a reality, but we wanted to show you that it's possible to overcome these barriers. Okay, so challenge number one, we highlighted like 6 main challenges. Okay, it's the slides. We try to be very pragmatic and to be self-explanatory. Okay, and let's go one by one. So change management and attitude face transparency. What we wanted to say here is like we have to introduce a change in the system. A change that means more transparency. And technology here, it's not a barrier; it's an enabler. It's acting like a hero. Well, we cannot say other way, because we are technology providers. But true, that is an enabler. Problems that we see on this aspect, we see a lot of resistance to change. It's not only on healthcare, in many sectors. Okay, we are starting to measure the performance and publish the results. So this is a clear barrier. We are going to share outside the hospitals the data of the patient, obviously in an anonymous way. So this raises a compliance concern, and hospitals' results will be compared with peers. So for the management of the hospital, also, it's a concern. What are my results, and how will be ranked with my peers? Okay, this is transparency. So solutions, obviously, a mindset, open mindset, a growth mindset. We have to change the way we think. Be very clear in terms of the goals and benefits that we are going to achieve with this. Okay, with this type of projects. Understand clearly the needs of all stakeholders involved in these projects. Okay, from the management to the IT teams of the hospital, compliance. Everybody must be onboarded and understand exactly their pain points. Okay, so and these have to be addressed. And the technology will be a driver of this big change that has to happen. Okay, and we see that. Currently, we see many hospitals embracing this change, wants to implement this. And Sophia mentioned a lot of initiatives that are happening worldwide. Okay, so challenge number 2, collecting data. So how do you get the data from the hospital to implement this? We see in some organizations that even they don't have any digital systems implemented. So that could be a problem. Some hospitals don't collect all the necessary data to implement a value-based healthcare project. And PROM data. PROM data is the patient reported outcome measurement. So the data from the patients. And this is not usually not collected in the hospitals. Okay? The ISHM standard set, as Sophia mentioned, the organization that is one of the most recognized in the standard set, implies collecting data in some formats that could not be the format that is used in the hospital. No, this could be a concern also. And then many clinicians ask, this will mean duplicating the work. I will introduce the data in two systems. Will be meaning more resources, double effort. So also this has to be addressed. Okay. So this data collection must adapt as smooth as possible into the current assistential or care process of an hospital. Okay, this shouldn't be very natural, very fluid. Okay, there are already technology solutions in the market to address problems like I don't have a digital system. There are already in place platforms, apps, web services. Technology is not a problem. Okay, to do this data collection, processes to do the normalization, standardization of the data to minimize errors, because we can get data that could be noisy, could have errors. So we have procedures to address these barriers. Okay, and the interoperability of the systems. The systems must communicate between each other. This is very important, and you for sure heard about it. So we put an example at the end of the slide. Like we had a case in a hospital that didn't have any digital historic clinical historic records, and it was possible to implement a solution that allowed the collection of CROMs and PROMs automatically in a systematic way in a matter of days, and with almost no impact to the hospital. So it was possible to do that. So we have like an example. We'll quickly pass through this. You see how it's like an architecture of this type of project, how we handle data from different sources to a system, and then this goes to pass through a process of normalization that is automatic and goes to a database that is obviously complied with all the privacy, GDPR, encryption, security standards and protocols. Okay. And mentioning that is the challenge, the next challenge that we have. So we have the compliance teams worried about the security and data privacy. So how is going to be processed the data? This will be how this will be loaded. It will be shared outside the hospital. It will be compliant with the GDPR of the location of the project. For example, we have a new European GDPR, so it must be compliant if the project is in Europe with this new regulation. All this must respect confidentiality, all the processes. Where is the database storage? In a safe server. So it's has to be also addressed. And data leaks, also a concern. So we are talking about sensible, valuable data that must be secure. So all of this is addressed. There are solutions in place in the market, okay, that saves the data and gives all the confidence to these compliance teams, okay, that the data are saved on a anonymous and encrypted form, okay. The infrastructures available are reliable, are flexible to adapt, okay. The servers obviously are in safe locations. The GDPR is compliant, okay. High security standards, protocols in the data collection and treatment. Obviously, we know that there are a lot of certifications in the market, periodic audits that will assure that these processes are correct, and backup policies. Okay, and again, this part is critical because it generates the confidence to all stakeholders. Okay, And this is also happening in several value-based healthcare projects in Europe that are being taken all these measures. Okay, then we have the confidence of the team, and now, what is the next step? What we have to do? The approval, the procedures. So some projects. We have like an expression that the castaway dies in the shore. Sometimes the promoter doesn't know exactly what he has to do, what are the internal approvals required, and some projects doesn't come to reality. Okay, understand the management of the consents needed, especially the patient consents to use the data and for what. Okay, so it's basically a consultancy project, and you have on the right side on the solutions all the documentation, the main documentation that is needed for this part. So where you documentation for the hospital and documentation for the patient. Okay, this is normally handled by ethical committees inside the hospital, and obviously this is very important in order to make the protocols to have the approval of this type of projects. Okay. Challenge number 5. So we have all the approvals. We start, and we see that patients are different from each other. We start to collecting data. We start to analyze the data, and we cannot. We must compare, as always Hisham says, the apples with apples, and we have to understand that this also is a question when you implement projects in our, healthcare organizations, that patients are different from each other. They have different initial conditions. They are different social demographic situations. So how do you address this? This is obviously a problem. The initial health status, how can I compare these results? And we always, we know that usually experienced doctors handle the most critical cases. So how do we compare these situations? So we have risk adjustment models, you see on the solutions on the right side, that will facilitate the correct benchmarking. See, all of this is for measuring, for comparing, but has to be fair. And we have to separate or even out the variables that could bias a correct benchmark or comparison. So there are statistical models that can address this. And we can do a fair comparison, okay? And then we have like a lot of guidance on that matter, how to apply and create this risk adjustment model. Okay? And lastly, so we have the data. This data is not biased, and what we do with it? What is the next step? A lot of projects, value-based projects, focus too much only on the part of collecting the data, and not. It's okay. It's the raw material, but the real journey starts from here, from understanding the benefits of the data. We have the data science, business analytics, all the metrics that we can have from this project. This is the richest part. Identifying the levers, the variables that influence the results. Any project is different. You will be like a complement to a healthcare organization that will give valuable information to the decision and to help them improve processes, because it's about, again, going to the beginning, to the smart data. It's not data, it's smart data. You are helping, showing how the results can improve, touching this lever, touching this variable, with techniques like clustering patients, that's grouping in segments. Okay, so healthcare professional performance, you can help identifying different levels of performance, comparing with the initial risk or the initial situation of the patient. So comparing hospital A to B, it's very, very interesting. And quickly, I don't know if I'm on time, but quickly I wanted to show you some examples of these benefits of these tools that shows the how the information, the smart data, is delivered to the healthcare organizations in the form of dashboards that shows analytic, descriptive analytics, predictive analytics that help the decision making of the physicians. Okay, so you have like examples of projects that have been done, dashboards created for this type of projects, where you can see a lot of information that are very valuable to the professionals. So just examples, okay. Okay, see what we can see here. It's like the patients that return to the operative theater within 3 months. So comorbidities, surgical complications, post-operative visual acuities. Here, what we see is like what influentiates, for example, in this project that is on cataracts, what influentiates a better visual acuity? What are the factors that influentiate a better outcome on the patient? Okay, that are like examples. Okay, so just to quickly finish, we have like we brought up three real examples, okay, that you may have heard about it. The Martini Clinic, Santion, and Nijmegen European Cataracts. Okay, the Martini Clinic, a private clinic in Germany, specialized in prostate cancer surgery, 15 years working in value-based healthcare. Okay, so you can see it publishes all the outcomes, all the results, with emphasis in these three major indicators. And you can then Google it and understand what they are doing, a major reference. The Santion, a Dutch group, also one of the pioneers on value-based healthcare. You see on the bottom how the results that they achieve. So reduced reoperations due to complications up to 74%, and unnecessary inpatient stays by nearly 30%. So we are talking about major improvements due to this type of programs, of projects of value-based healthcare. And then ISHM European Cataracts, also an European project involving many hospitals, 10 hospitals across different European countries. So where CROMS and PROMS was measured, and we saw a lot of improvements on the cataract surgery due to this project. So to finish, sorry, a lot of information, and we wanted to talk and to tell you about. As the main conclusion, this is a reality. This is happening right now. Technology definitely is a driver, okay, not a barrier. It's here to help. And the pioneers of today will be the leaders of the future. What I want to say here is, who embraces this now will see the benefits that will bring in the future. Thank you, and I will address the questions at the end. Thank you.
Thank you, David.